Valerie, maybe we could turn to you and ask you to kind of comment from Varian's perspective. How does a company like Varian work with let's say the governments of Ethiopia and the private sector to ensure access and quality for the good services that you all provide?
Wonderful, thank you, and thanks everyone for cooperating with my inability to navigate New York City during UNGA. I apologize for being a few minutes late and missing the opening remarks. From what I have heard, though, before I just talk a bit about, how Varian specifically fits into this picture, there's a couple of things that stood out from the comments already. For example, the hyperfractionation angle, which is really something that we're very passionate about. That's something that we think can help. It reduces wait times. It has this dramatic increase on output that is really effective, that can really, make it so more people are treated, back to work, and then live a productive, healthy life for the rest of their lives. Obviously, though, that requires investment, and Varian makes linear accelerators, and that's capital equipment. And, I'm not here to say that that's a low investment. That's just the reality of these long-term investments that we're talking about. So one thing that I want to be sure to point out is that the way that Varian approaches this type of work is in the long term. We want to be on the ground. We want to be at the hospitals working with the teams. We don't want to have a piece of equipment that people don't know how to use and that people aren't treated on effectively. So we're very committed to not only being there, I think, at the beginning stages where we determine, we want to be there with you when you're doing a needs assessment. We want to be realistic about what the capacity is and what it takes to get there. And then more importantly, we want to make sure that we are training staff. We want to have the right techs, the right doctors, the right enabling system across the government to make sure that we can actually bring care to these women. And, on a personal note, I'm a big believer in healthcare as being an investment. We have to invest in these types of projects, particularly for the women of the world who, have been underserved in general. And really, there's a lot of care that they can live long, productive lives where not only they can be part of the workforce, there's the caregiving economy. I mean, there's a cascading effect down where I think can have a real dramatic impact on women's health. So all of that to say, I hope that that we can be a partner in this. We're extremely supportive of these types of pilot projects. It's how the company itself is starting to think about how to connect, more tertiary care, more rural care to these hub areas. And, we have the tools to do it. We can, do remote treatment planning. We can scale up the way that we read scans, that way that we train staff. So while we're working on the ground to staff up, it's almost as our staffing goes down, the capacity of the staff on the ground goes up. So those are just some initial thoughts. I'm really pleased to hear this conversation today and open to any ideas. Thanks for having me.